So on the way, feeling pretty nervous. Have to do a physical and a second opinion interview. I have to do an interview with a third, well, they call it a second interview, but it's really a third psychologist or psychiatrist who has to approve of me doing the procedure, which I'm not too worried about them denying it, so should be okay. But yeah, so I will update after it's done.
Do you remember what happened exactly?
I actually do remember they said that there could be some issues with short-term memory loss, but I haven't experienced that yet. I remember going in. They wheeled me on the bed into the room and were hooking me up to all the different machines. I was hooked up to an IV. Um, I and they were talking to me, just kind of making small talk, honestly. And then they told me, okay, we're gonna, when we let the anesthesia go in, they did it through the IV. It'll sting a little bit. And so they let me know when that was going to happen, and they told me when it does happen, you'll know that you're about to go out. And so when it started to sting, I tried to, kind of fight it a little bit. I mean, I didn't feel any sleepiness coming on at all, and so I was like, oh, this isn't that big of a deal. And then I was gone. And then I woke up and was very, very confused and didn't even realize I'd actually had the treatment yet. I guess I did have a little memory lapse because I didn't remember that I had gone in to the room where they were doing the actual treatment. So it was really funny because my mom said, oh, okay, so how are you doing? And I said, oh, I'm fine. I just really want to get it over with. And she says, well, you've already done it. It's all done. Oh, well, that's relieving to hear.
Were you scared when you got to the hospital?
Yeah, I was really nervous. I knew that it wasn't gonna hurt, like I wasn't gonna feel pain or, anything like that, but it just is scary thinking I'm gonna have a seizure and I'm gonna be going under. I've never gone under before. I mean, I know a lot of people probably have gone under for wisdom teeth and that type of thing, and I've never had to go under before, so that was a little scary. And then just, I don't like needles, but I can deal with needles.
Did the doctors talk to you at all and let you know what was kind of going on?
The staff was amazing. Every single nurse, every single doctor that I was going to be interacting with throughout the day was very informative, so nice. It was a really great experience as far as the staff was concerned. Everyone was just so understanding, and they just truly seemed like they wanted to help, and that made me feel really good. And because it is kind of, it's not something to be ashamed of, but I feel ashamed of it a lot of times, and so going into that situation, you kind of fear judgment of others, and I didn't get that vibe from anyone, which was really, really great.
Did you experience any side effects afterwards?
I had a really, really bad headache. They gave me some medication for it, which helped temporarily, and then once I had actually left the hospital, the headache came back. So I'm going to ask them about that and see if there's any way that that can be prevented, if they can give me more medication so that I won't continue to have a headache. But yeah, that was pretty lame. I just came home and I just crashed, but my head felt so heavy, and it it wasn't fun. But it wasn't overly painful. It wasn't anything. It wasn't unbearable. But it was just kind of like inconvenient.
Now that you've had the first treatment, are you going to be more afraid or less afraid the second time around?
Less afraid, because yeah, I don't remember a thing. So I know that that's not going to be an issue. I'm a little wary of, a headache. But I mean, you get headaches all the time. It's not anything to be afraid of. And like I said, they'll probably be able to give me more medication, so that it isn't so much of an issue now. So I mean, obviously, I'm not feeling any different as far as the depression is concerned. I'm not super down right now. I was very down this morning. But going through all that, and I think sleeping kind of helped too. But I mean, they told me I'm not going to be really seeing results as far as the depression's concerned for probably 5 to 6 treatments. But I will continue to update every day that I have the treatment, and let you know how things are going and what I'm feeling and what happens, and hopefully this is helpful. So thank you so much for watching.